Bicuspid aortic valve is one of the most common cardiac abnormalities and leads frequently to aortic stenosis. The standard of care for the treatment of aortic stenosis in a vast majority of cases TAVI, and unfortunately, bicuspid aortic valve has been an exclusion criteria for most of the randomized clinical trials comparing surgery versus TAVI. I'm the Dr. Pierre Deharo from Marseille, France, and I'm very pleased to present our paper entitled Surgical versus Percutaneous Treatment of Bicuspid Aortic Stenosis, a propensity score match analysis. It will be published in Mayo Clinic Proceedings in the January 2026 edition. So thank you for interviewing me today about our propensity score analysis. We were very happy to present this paper during a late-breaking trial session of EuroPCR 2025. We designed this study because we have retrospective analysis showing feasibility of TAVI with good outcomes in patients with aortic stenosis, despite variability according to bicuspid aortic valve morphology. There is clear risk of TAVI in a bicuspid aortic valve, mostly risk of paravalvular leak, annular rupture, coronary reaccess, and maybe structural valve deterioration. We have a recent data coming from a randomized trial from the Nordic published in European Heart Journal showing that there are divergent outcomes according to the bicuspid or tricuspid characteristic of the aortic valve when we compare surgery to TAVR. So we use TriNetX platform between 2012 to 2024, including over 151 million of patients. And we selected only patients with bicuspid aortic stenosis who would undergo either isolated surgical aortic valve replacement or isolated TAVI. So in the end, we had a cohort of 12,000 patients with a majority of surgical patients and 2,600 TAVR. We perform a propensity matching analysis, and in the end, we had a cohort of 1,195 patients per cohort. So 1,195 surgical and the same in the TAVI group with a mean follow-up of 1.9 year. What we showed is that obviously there is baseline difference between patients who undergo surgery or TAVI. Probably the patient who had TAVI were at baseline older and sicker than the one who undergot surgery. But after propensity matching, the two cohorts were comparable in terms of baseline characteristics. And what we saw mostly is that after around 1 year, we had 2 times more likelihood of death following TAVI than surgery in this particular cohort of patients with bicuspid aortic valve. And when we analyze another composite outcomes of myocardial infarction, stroke, heart failure, and death, we showed again that TAVI was associated with higher composite outcome probability compared to surgery. This is the largest retrospective cohort with the longest follow-up comparing surgery versus TAVI in bicuspid aortic valve. There is a clear word of caution for liberal use of TAVI in the young patient with bicuspid aortic valve, and we should keep selecting patients very carefully and probably individualize our decision according to the type of bicuspid aortic valve we are facing. And we definitely need a dedicated randomized clinical trial comparing TAVI versus surgery in patients with severe aortic stenosis and bicuspid anatomy. I thank you for your attention.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel. www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.